CDC and everything, but can you tell us again, what have you been up to since you left us and you've graduated?
Oh, this the let me start.
Don't worry.
The 1 year doing the MSc here was like, for me, life changing, I would say. Uh, uh, and since I graduated, it's like it's been so helpful. It's been so beneficial that I've like progressed so far in such a short time. It's just been less than 2 years, and when I got back, I got the job as the head of quality improvement in the main tertiary hospital in the country, whereby I had to look into patient safety, clinical audits, and make protocols and guidelines, which we were taught in a different note, but I had to apply that knowledge in a slightly different setting because it was a more clinical hospital settings rather than disease prevention on the ground. So the application aspect had helped a lot, and my work outside of the hospital included a lot of voluntary and technical work in health NGOs like the Diabetes Society and the Cancer Society of Maldives, which I had co-founded. We progressed a lot with developing screening programs for cancer, like having conducted a lot of screening camps to the islands where the services are not available, which was like basically the core of what I learned here. So this helped me improve those programs a lot more. And one other thing is the academic aspect and the research, which we learned here, has helped me go more into the teaching side of applying knowledge rather than just using it for work or for a preventive or clinical aspect in health. In the hospital that I worked at, we did not have a formal teaching or academic program per se, but then I got the task of developing such a program with a few colleagues, and then the National Healthcare Academy was born last year, April, and I was appointed as the Vice Dean for Academic Affairs, and this was a huge progress in my career because earlier I was more clinicals or program based, and then now into training and teaching plus improving on research that we lack a lot in most developing countries. So this has given me a huge boost. And one other huge achievement, I would call it, is formation of the National Non-Communicable Disease Alliance with membership at the Global NCD Alliance. And like I co-founded it with 3 other NGOs. And we've been liaising with the Global NCD Alliance to develop our programs back in the Maldives, which has given a boost and which has progressed my career personally as well, because I've got through the alliance a lot of networking exposures, conferences, and lots of technical knowledge which has been shared because of this new formation of the alliance itself. So like the couple of years after my MSc has been like a huge boost, and now I'm like moving on to still more studies, I guess, because I've been awarded the Hubert Humphrey Fellowship from the US State Department, fully funded to be studying public health policy and management at the Emory University Rollins School of Public Health. And a lot of the coursework would include working with the US CDC and a lot other international NGOs, the Carter Foundation, and it all depends on how the program is tailored and developed for one particular person alone. So it's very it's a combination of how I would want to use this 1 year to work on whichever areas that I'm more interested in. And I would definitely go for some more of learning research and then trying to bring it back home and getting it done a lot more, because it's one area, as I mentioned, which we lack, or which we lag behind. So this course, this graduating in MSc PhDC has broadened horizons for me. It's been life-changing.
That's amazing.